welcome to our show. We walk, we run, we jump, we bend and kneel on them daily, and yet we don't give a second thought of it. What am I talking about? It's your knees. Hello? Okay. Is it too? Sound check, sound check. Okay, good. Just double check. Test, 1, 2. Okay, good. Just double check. Okay, so it's your knee. It's complex and most prone to injury, and it affects people no matter how old you are or how young you are, or adults, young adults, and children. Let's find out more about the knee and how to fix it after this message. Okay. Hi, welcome back to Stress Out Stress Free. My name is Vincent Woon. If you haven't met, welcome. My name is Vincent Woon. Alright, we help people like you stay stress free by changing one habit at a time. And if you're new here, please put new, and we'll welcome you. We probably welcome you. Okay. Alright. Even though you are watching after this, don't worry. Put it down. I always come back and check for chats and messages. Okay. All right. The knees. The knee joint is a weight-bearing joint of the whole body, and helps us to move around. So we have to always be aware of what we do and make sure that we're not adding burden to to stress it, or not add any weight to stress it, right? Okay, it's about 80% of the knee problems people can resolve it by staying home. This is said by Robert Golding, Director of Orthopedics for Sports Rehab at Beth Israel Medical Center in New York. Okay, so let's find out what are the causes of knee pain, right? Okay, the most common ones are arthritis. Arthritis is divided to like three different kinds of arthritis. Okay, osteoarthritis is the wear and tear of the knee joint. So most common cause, and for people who are 65 and older. Yep. Not that I'm saying you're old, but for people that are 65 and older. Okay, the second arthritis is called rheumatoid arthritis. Rheumatoid arthritis involves the swelling of your knees, followed by redness, the tenderness, warm and swollen. So it is caused by autoimmune. It's an autoimmune disorder that causes inflammation of the joint. And third one is gout. Gout is characterized as a sudden attack of pain, swelling, tenderness, and redness in joint. So what is there's too much what do you call it, nitric acid or chloric acid, something. Your body has too much protein that it creates the pain. Okay, so I have a friend that has gout, and every time he eats a piece of red meat, he's gonna have pain. And the problem is he likes red meat. We grill steaks all the time, and he loves it. But the thing is that he has to stay away from the pain. I mean, from the steak. So he has to watch his diet all the time. Okay. So what are the causes of knee pain? So knee pain. Do I sound weird? No, right? Give me a thumbs up if everything is okay. If it sounds good. Okay. Or just put in the chat below and let me know that if I sound funny. But hopefully it sounds good. Yeah, I think it sounds good on my headphones. So yes. just double check here. Alright, sounds is good. Okay, knee pain also caused by injuries like fracture, sprain, and dislocate and tear of ligaments. Also, it is caused by obesity. Why? In our society now, people like to eat a lot, and or sometimes people eat a lot when they're depressed. So obesity is a big problem now in America, and because of the fact that you put on weight on your body itself, think about it. Your knee is just a joint, and you're putting too much weight on it. Whatever you put too much weight on, it will just create problem for you. Okay. So next one will be overuse of your knees, like trauma or too much exercise, too many physical activities. Like for instance, athletes and people who are gung ho with working out. Okay, it's also caused by sprain, sudden unnatural movement. What do I mean by that? Sometimes you just like you stand up and then you're like, I did a wrong move, like ouch, and that's you kind of like mess up your knee a little bit. Okay, so the other one will be dislocate your kneecap. It's a common injury, and it's a sudden blow that changed the direction, especially in dancing and sports. Okay, you guys watch the Olympics, right? So there might be some injury caused by the Olympic Games too, right? Okay, so as the doctor said earlier, the osteopedic said earlier that most of the 80% of the knee pain can be taken care at home. So let's go to check out some home remedies, right? Okay, home remedies, the hot and cold pack. So heat therapy is used for stiff muscles and joint. Okay, and ice therapy or cold therapy is ice packs. Ice helps reduce the swelling, and it helps slow down the blood flow to the joint area, and you can use that to reduce the swelling, and but not more than 20 minutes. So you have to make sure you put it on and then take it off, rest for a little bit, because if not, then you might burn your skin. Even though it's cold, cold can burn your skin too. Okay, so the next one will be to get rid of pain or strain. We call it price. P, to protect your knees. You protect your knees. Put some band-aid to tighten. Use something to hold it so that you won't re-sprain it again. Rest. RPRICE, right? Price, right? So R represents rest. So you rest your knee for 2 or 3 days, and ice simply apply that for 10 to 15 minutes in the beginning. When it's swollen, just apply ice for 10 to 15 minutes and rest, and then do some compression. Compress it with bandage and minimize the swelling. That's C, compression. And price, PRICE, E is the last one. Basically, to elevate your leg to your heart level with a pillow or something. So basically, you kind of like sit with a knee up like that with a pillow, so that your knee is level to the heart. Okay, and also that's price. Okay, and home remedy, we have to watch our posture, make sure it's proper, and if you need support for your posture, do that. Okay, this is pretty important. Always wear proper shoes. Why? Because if you don't wear proper shoes or you wear worn-out shoes, you hurt your ankle, right? You hurt the ankle. And I always say, if you mess up your ankle, you'll mess up your knees. When you mess up your knees, then you mess up your lower back. When you mess up your lower back, then you mess up your upper back. When you mess up your upper back, you're going to mess up the shoulder. When you mess up the shoulder, then you mess up the neck. And then mess up the neck, you can have that pain in the hand. So it all triggers, and that's why we have to start from the bottom or up, So wear proper shoes. If you look at the shoes, if the shoes is like kind of like flattened or smooth on one side, try to walk the other way. But the best thing is change your shoes. It's better to get good support or get better shoes so that you can support your feet better. Okay. Get enough movement. Get enough movement. Okay. You need to move a lot to so that your there's get rid of the pain or you're talking about knee pain. So get rid of the pain. You do some movement and start doing some exercise so that slowly with the exercise do the exercise slowly but not crazy, because what you want to do is to create circulation into the area. Why do doctors and surgeons ask you to get up and move after a knee surgery? Why? Because you need to create circulation, because they cut you open and there's a lot of scar tissue, and you need to do some movement to bring the blood and oxygen to the area. Okay, once again, you need to lose weight, like,
1 sec.
What's that? Oh, quiet up, Siri.
Sorry, I couldn't hear you.
Siri, be quiet. Let me shut you off. That's what happens when you have Siri, right? Not talking to you. Okay. Epsom salt. Epsom salt is my favorite. When I was working, way back when I was working at a restaurant, paying for school. I'm the crazy type. We do a double every week, every Saturday. So we work like from brunch to dinner. And what happens is, when you stand a lot and you walk a lot, in the restaurant business, if you have aches and pains, right? So this is my favorite, because what I do is after my shift at night, I go home, Epsom salt, lukewarm water, and lie down and relax. And this is the most relaxing thing. And if you have muscle ache, joint pain or whatever, just soak it in Epsom salt. You feel like buttery. And I also learned that instead of Epsom salt, you can also use hydrogen peroxide. Hydrogen peroxide is, I think it's O4, I think. So basically, it's oxygen. When there's oxygen, it creates circulation. Okay, so it brings oxygen to absorb into the body, and it feels relaxed and help you feel good. All right. Okay. Also, I forgot to bring also collagen. Collagen is like a protein-based supplement, and it helps. It's like a glue. It's a natural glue that binds our skin and joints together. It helps kind of like build more collagen and help lubricate your joints. Okay. When do you go see a doctor? Of course, I'm not a doctor. I don't play one on YouTube or videos or TV, but these are all my suggestions, and this is what I gathered through my research. So when do you see a doctor? These are advices from the doctor. So if your pain persists, you stay for, it was painful for 1 week, 2 weeks, still pain, definitely go see a doctor. If you're in an accident, oops, 1 second here. No power. Okay. All right, power is good. If you're in an accident, car accident, forget it. Go straight to the doctor. Or any kind of accident, like you fall, you feel like the knees are swollen and it's hard, and if you have fever, forget it. Go see the doctor. All right. Okay, those are the few, and let's see. Let's do some self-help and massage. Okay, this is going to be slightly something different. Let me just switch the scene. Turn the light on a little bit. Okay, let me just switch the scene to. Ta-da-ta-ta. Uh-oh. Where is the scene? Ta-da-ta-ta. Is this the one? Yeah. All right. Let me just come over here. Hands up. Hi. Can you see me? I have to move on the side a little bit, right? Okay, let me just move this on this side. This is my ball. And then I'm going to put my knees here. Okay, this is your knee, right? Okay. Let me just. This camera is a little crooked. Hi. Is that better? Hi. Okay. All right. Put the mic closer. And you see my knees here? Just do a little bit. Okay. All right. This is your knee, right? Usually the pain, sometimes the pain is on here, on the side, sometimes on the bottom, right? So with your, forget it. No. Let's not do this first. Let's do some stretch first. Push the ball away. Okay, let's do some stretch first. So what you do is stretch your knees straight up. Just sit normal, and then press your knee up like such. Okay, do slowly. 1, stretch down, stretch 2. The other leg, the other knee. Oops, is it showing? Why is it not showing? Hold on a second. Let me just fix this real quick. Okay. All right, good. Not too confusing, I hope. Okay, so why is it showing one knee? Okay, basically this you do the knee stretch like such. Down, down, up, and down slowly. Okay. Let me show you the other knee. What's the other knee? Up, down, up, down. So basically, you get the idea. That's to stretch your knees. Okay. Let me just bring the ball back and show you how to massage the knee. Okay. Let's go this way. So usually, knee pain. In fact, myself has some pain here on this side, and it's on the side of the kneecap. Okay, sometimes it's the back too. So with your thumb pad, just go circular movement around the knee. Let's go like such. A circular movement, or you can use all the finger pad of the fingers. Let's go round, round, round. Do it with me, so you can feel it and experience it. So let's go around. If you feel feel some tightness there, just dig into it like such. Let me see pressure there. Dig into it. That's up, down, circular, left, right, left. My left, your right. My right, your left. Okay. All right. So basically circular movement. Go around. If you feel any tightness, that's what you do. Just go. I like to use the ball because it's more flexible. If you bend your knees a little bit, it's kind of like a little difficult and it's more painful. Okay. So you want to loosen the cap around the cap here. Oops, okay, there's something here. So we just go walk around there. Rub. Oop, tight muscle here. So you go dig into a little bit, and then once you dig a little bit, when you do the circular movement, okay, sorry about that. Mic is too far. It's my other mic. Circular movement so that you break down the tightness. Okay. All right. So right now everything is pretty good. So that's number one, loosen up the area. And number two is just what you want to do is use your side of your palm. Just go like such. It's kind of like rub it, okay, like such. So it's like, see, like such. Rub it. As you rub it, you can feel heat going into it. All right, heat going into it, and what does heat do? The heat brings blood into the area. When there's blood into the area, it brings oxygen. When it brings oxygen, pain is gone. Bye pain. All right. Okay. So this is one technique you can do. Basically, you just use your palm. Use your fingertip. Go around. Make sure it's like kind of like checking your knee area. We see. Hey, let's check out which area is tight, which area is loose, which area is normal, which area that's painful, right? And then after that, just use your palm, side of the palm, just create warmth around and to kind of like break down, melt down the area. So that will help. Okay. The next one, ta-da! Get a tool. Basically, this is called a gua sha. That's something that is a tool that we use to help massage. In ancient Chinese, gua sha, actually what they do is they actually use a metal spoon, and then they really scrub it like like such. So, but I use this. We can use this for the face too, to face massage. And sometimes, if I'm lazy, I do my neck massage like such. And then neck massage this way. And sometimes I just want to do one point. I just poke right into one point and then work on it. Let it break it down and let it relax. And it's pretty cool. You can find it on Amazon. I'll put the link down after. In the description after this. So basically, use the flat side. It comes in many different shapes too. So depending on, I like the big longer one so that I can cover more area. They have a smaller one, and they have many different sizes and styles. So you can choose whatever you like. They even have it in jade too, which is a cool thing if you're into stones. Okay, so basically same thing. Just go around, look for tight spot. If you tight spot, you can see this little small thing here. You can go into one spot and you can find. If it's deeper, just go down like such. Go deeper. So this one will help cover more area. Of course, you can put some lotions so that it's not so. So if your skin is dry, put some lotion so it will not will not tear your skin. Okay, so I've done this. I've used this throughout the week, so I know which area to attack and which area to work. So and then how hard you want to. So basically, go look for the tightness area. If you find some tightness, stop there and let's go down. Use the little tip and go down. Like sometimes it's better than using the finger, because finger sometimes is tiring. You're holding this and let's go scrap,
Guasha, guasha. And then down here, guasha, 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 guasha. And then you pretty much like create circulation in the area. So at the end, just rub it with your palm around. You can feel the heat. I can feel the heat already. Let's just go a little faster. Stop. I like to do this because after you do that, you can feel the heat like slowly melting down. And after you're done, you still can feel it. I do it to my client, and they all love it. Why? Because after we finish while we're talking, you can still like feel the heat absorbing and melting down into the muscle. So let's do this real quick. You can feel it, and that's how you feel. Okay. For people that have knee surgery, so usually they have a cut here. I have a client that she had knee surgery. They have to have knee surgery. So at first, when she came to me, she didn't come to me because she was still in pain. And then when I saw her, she had the scar about this size. I would say like maybe a quarter of each, like scar. After you have surgery, your scar, right? It's big, huge. So what happened is they cut in the middle and then they stitch across, right? So when picture a piece of meat, you cut it up. Let's picture like maybe pork or something. You cut the pork up. Okay, it opens up like opens up this way, right? So and imagine that the pork has plenty of layers, correct? So the layers in the pork. So when they stitch it up, they stitch layer by layer by layer by layer by layer and up. So it's like a bunch of knots. They stitch this up, right down here all the way, and then they stitch the next line in, and then next line, and then next line, and then they stitch the top, right? So what happened is all the layering creates scar tissue, and what happened was there's a lot of scar tissue. Somewhere down the line, it's going to create pain because basically all the tissue was stuck there, so it's create a big knot in the knee area itself. So what you can do is put some lotion and always do a cross fiber. Why cross fiber? What I meant by cross fiber, if the muscle is this way, you go across this way. So when the stitches is right, it's like this, right? Excuse me. When the stitches is like this, right, you go across, you break down all the tightness, right? So you break down all the tightness. So when the stitch is, when the cut is this way, so you do sideways. You put some lotion and do slowly. Just go like with your finger when if you after your surgery, after they take out the bandage and everything, you see the scar there. Just when you're watching TV, just do rub across. Anytime you have time, anytime you have a chance to do it, just rub across. And when you rub across, it just breaks down the muscle, the tightness. Okay, so let me just switch back to my other camera. I'm back here. Ta-da. Where are we? Okay, welcome back. Okay, let's see. Okay, good. Let me just, this is mute. Okay. All right.
So that's pretty much all I can talk about knee pain. Actually, I forgot one. Should I show you this time? Maybe next time? No. Let me just show you again. Okay. Let's go back to the other screen. How can I forget that? Okay. Let's go back to the other screen. Alright.
So basically, you sit down, put your hand like that, and if you have knee pain, my friend actually, he worked in a restaurant and then he accidentally slipped and messed up his knee a little bit. So very, very easy. Cup your hand like this, then go like such. It's very simple. Let me bring the ball back. Okay, elevate it and then just go. Make a hole down there. Same thing. Pat. Okay, not flat hand. Flat hand is like smacking it. If you do a cupping, it has that pressure, and number one, it's not so painful. Number two, it creates circulation into the area. So, and there was this old lady, maybe I think she's about 65 or 70 in China. She said, "When I have knee pain, no problem. I do this every time. Every time I sit down, I do it." And then she goes like this. She goes really high, so that creates the motion and the circulation from the area. So, see, I go high. I sit down, do nothing. I do this too. I am free. I do this. I do all the time. And she did it for non-stop, like not like non-stop. She do it every day for about 4.5 months, and now she's walking like normal, better than the young people. Okay, all right. Maybe just move back to the other camera. You're gonna see me moving, but it's okay. All right. Okay. Thank you for watching me jumping back and forth, and thank you very much for watching. If you like this video, or you know someone that can benefit from it, or you can benefit from it, don't forget to like it, and also share with somebody you know that you think can benefit from it. Okay. If you new, don't forget to subscribe. That's how I help my channel grow. And thank you once again. Thank you for watching. If you want, you can support me at Buy Me a Coffee. Let's see what's going on. Yes, if you want to support me, you can support me as Buy Me. Oops. buymeacoffee.com/Vincent Woon, and I see you in the next video. And don't forget to stay stress-free by changing one habit at a time. Thank you for your like, and if you watch after this, also put a like so that we know that you enjoy it, and that's the more likes the better. It helps support us. Thank you. Test 1, 2. Alright. I think I have the other mic on that's creating sound. As long as you can hear me, thank you.